Let's go ahead and get out our manuals there and go through the, folks, did I by chance, did we do the labeling for the upper extremity? Does anyone recall? I'm almost positive we did, but I just want to make sure I'm not losing my mind. Anybody? Okay, cool, perfect. Well, let's label this. And then we'll finish up the lower extremity and then label the remaining part of it. Okay. So last class, we talked about the pelvic girdle and the pelvis. And so the bones that do help to make up the pelvic girdle are the right and left os coxa. So there's a couple different names for this bone. You can call it the coxal bone. You can call it the os coxa, or you can call it the innominate bone. Lots and lots of different names. But as you recall, this bone, I told you, was once made up of 3 separate bones, and they've fused together, usually between ages 13 to 15, puberty. Okay, so we're going to talk about the ilium first. That's the largest of the 3 bones. It's the most superior portion. This is a lateral view of our os coxa. I know it to be a lateral view because I can see the acetabulum. That's always on the lateral surface there. All right, and so now we flip it over and we can see the medial side. I don't see the acetabulum, so I know I'm on the medial view here. So again, we're looking at the ilium. It's going to make up the majority of the os coxa there. So now we're back out to the lateral view. All right, the bone that's going to be more posterior and inferior to the ilium, that is going to be our ischium. And here we can see it on the medial view. So there's our ischium, and then finally our last is the pubis, and that's going to be more anterior and inferior to the ilium. All right, there it is in the lateral view, and here it is on the medial view. So we'll go through and run through some of the landmarks that you're going to find on these different areas here. So of course, let's talk about the one that's the most prominent is the acetabulum. That's our cup for our ball and socket joints. And so that's where the head of the femur is going to articulate. Then, now this doesn't quite do it justice when we talk about the iliac crest. All right, the iliac crest extends pretty much from this end all the way down to here. All right, so that whole area is going to be the iliac crest. And so you can see it here on the lateral view. All right, and then if we go all the way to the front, the anterior portion of the iliac crest, that nubbin there, that's the anterior superior iliac spine. And then what we're going to do now is we're going to go all the way back to the other end of the iliac crest. Okay, here's the anterior superior iliac spine. So now we go all the way back to here. And that's our posterior superior iliac spine. All right, that's that big bump that you feel on either side of your spine there in your low back. It's the posterior superior iliac spine. And here you can see it from the medial view right here. Right, posterior superior iliac spine. On the medial surface, you'll see a nice smooth area there. That's the iliac fossa. One of our muscles sits there. It's called iliacus. We'll talk about that in chapter 11. Okay, but that's the iliac fossa, that nice smooth region there. And then, of course, the part of the os coxa that articulates directly with the sacrum to make the sacral iliac joint, that surface that we do not see when the sacrum is in place, that is our auricular surface, the auricular surface there. Then you can't help but notice this big, huge notch here, and that's where our sciatic nerve is going to run through when it's exiting out of the pelvis there. That's called the greater sciatic notch. The greater sciatic notch. There you can see it on the lateral view. Greater sciatic notch. Then you'll notice just below the greater sciatic notch, you got a little bump there, all right, that little projection, that's our ischial spine. we're going to see the ischial spine on the ischium. That's the second bone there of our os coxa. And then inferior to the ischial spine, we have our lesser sciatic notch. All right, well, everybody, you're sitting on this structure right here. That's your ischial tuberosity. That is where, all right, where you're bearing all of your body weight for the upper extremities and your trunk there. And also your hamstring muscles attach onto the ischial tuberosity. Then we'll move here on to the pubic or the pubis bone. And you have this little extension here coming off of the acetabulum. That's the superior pubic ramus. That is that part of the bone that's found above the obturator foramen, which is this hole right here that we're seeing. Then you can see the superior pubic ramus from the lateral view. Okay, because this is a three-dimensional structure, it doesn't look very big. And then you can see below the obturator foramen, then you have this area here, that's the inferior pubic ramus, from pretty much here to here. It's the inferior pubic ramus. You can see it a little bit better here. And then, of course, you have the obturator foramen, the only hole in this bone that you have to know, obturator foramen. And then, of course, where the arrow is pointing, that is pointing to where the pubic symphysis is. And that's where the right and left os coxa will articulate with one another at the pubic symphysis. And you'll have a little fibrocartilaginous disc there that you can see in this picture a little bit better. There's the pubic symphysis. All right, and then you can see the acetabulum there in the lateral portion of our pelvis. And then there's the acetabulum one more time on our lateral view. And then, of course, our sacroiliac joints. That's where the sacral bone articulates with the os coxa to form the sacral iliac joints. All right, this is an example of a female pelvis, and we can tell because of several displays here. All right, you have the subpubic angle right there is nice and wide and convex. And you'll see that the ala here, right, that area of the pelvis is wider to accommodate the baby. Female, all right, pelvis will have a much wider spleen there. It's tough to see, all right, but the sacrum would normally be shorter, okay, more shallower, right? So this opening here that you can see, and you can't see the other opening, but that is back down in here, right? The distance between those two areas is the pelvic brim right here, and that's basically the birth canal area. And that's going to be much more shallower in a female pelvis than it is in a male pelvis. So here you can see the subpubic angle is more like a V. Okay, smaller area here. And all right, this part of the ilium doesn't flare out as much. Much smaller, not really going to fit a baby as well as you would see in the female pelvis. Okay, let's move out of our pelvic girdle, our pelvis, and get into the lower extremity. Let's start with the leg. There's only one bone in the, excuse me, not the leg. Let's start with the thigh. There's only one bone in the thigh, and that's the femur. Okay, so the proximal epiphysis there, that rounded surface, that's the femoral head or the head of the femur. Okay, you can see it on this slide here. By the way, this is an anterior view of the femur, and this is a posterior view. Okay, certain things. Look here, the distal epiphysis. You can see the condyles much better in the posterior view. You can't see the condyles down here very well. Okay, but that's usually how I like to tell the difference between the two. All right, you'll notice that there's indentation there in the head, and that's called the fovea or the fovea capitis. That's where the ligament of the head of the femur articulates, all right, with the head of the femur. So that is the fovea or fovea capitis. Okay, then the head narrows down slightly, and that's the femoral neck. Here you can see it on the posterior view. All right, and then you'll have the structure opposite the head, this big bump there on the bone, and that's the greater trochanter. And then you can see the greater trochanter on the posterior view here. Always know that the head of the femur is on the medial side of the bone, just like the head of the humerus is on the medial side of the humerus there. And then you can see the lesser trochanter. That's a site for muscular attachment. Right? One of your strongest hip flexors attaches onto that point. Here you can see it on the anterior view, and then now you can see it on the posterior view. That is the lesser trochanter. All right, and then you can see on the distal end of the femur. All right, we're looking at it from the posterior side because you can see the condyles much better. And I know it's the medial condyle because it's on the same side as the head of the femur. So that's the medial condyle. There's the lateral condyle. Lateral condyle is on the opposite side of the head, but it's also on the same side as the greater trochanter, and that's the lateral side of the femur. All right, and then above our medial condyle, we have this little bump here, and that's called our medial epicondyle right here. It's a site for muscular attachment. Now you can see it on the anterior, or excuse me, the posterior view. You can see here's the lateral epicondyle. Again, that's a site for muscular attachment. And then, of course, we have this space in between the two condyles, and that's going to be the intercondylar fossa. And in that fossa, we're going to find our anterior cruciate ligament and our posterior cruciate ligaments, which we talked about earlier. And here's a nice view of the patella, anterior posterior view. On the posterior view, you can see articular cartilage there because the posterior side of the patella directly articulates with the femur. All right, let's stop here for right now. And what we're going to do is we are going to, that's not the one I wanted. All right, we are going to, oh Lordy. All right, let's go and finish up the appendicular skeleton here for the lower extremity. And then we'll label, and then we'll be all done. Okay. Oops, that's not the one. There we go. All right, sorry for that. Small technical delay, but we're back on track, people. Okay, so let's go ahead. Jump on that. And we'll talk about now the remaining bones of the lower extremity. So we're going to move on to the leg. And that's where the tibia and the fibula are going to be hanging out. Much like what we saw in the forearm, we had two parallel bones in the forearm, the radius and the ulna. We have two parallel bones here in the leg, the tibia and the fibula. Now, the tibia is going to be the weight-bearing bone. This is the one that's going to be more medial. And then it's going to be the thicker, bigger one. So therefore, we're going to be weight-bearing on that bone. But the smaller, thinner, more slender bone is going to be lateral, and that's the fibula. And so we saw there was a connection between the radius and the ulna on the forearm. Well, we have another connection going on there, all right? That same type of material, that dense regular connective tissue, which we call the interosseous membrane. And so that is going to be found in between the tibia and the fibula. And it does the same thing that we saw in the forearm. I didn't want that to happen. What we see, it's going to help to stabilize, all right, the position there of both of those bones from one another. So they're not encroaching on each other. And it helps to provide that pivot point. We don't get a lot of pivot movements in the leg like we did in the forearm. We're not going to have that kind of pronation, supination, right? But there is some rotational component that will occur in the leg there. So let's look at the tibia first. There it is. It's the bigger bone, thicker bone. right? That's the bone that is going to be weight bearing, and it's medial, right? It is the medial bone. So on the top portion, on the proximal epiphysis of the tibia, we have these flat surfaces that are on the superior part of the bone there, right? And so they're going to articulate, these surfaces are going to articulate with the condyles of the femur, the lateral and medial condyle, right? So in between these flat surfaces, we're going to have this little ridge-like structure, and we call that the intercondylar eminence. So you'll have one flat surface, another flat surface, and then in between, you'll have this little structure that sits in between there, and that's called the intercondylar eminence. And that's what we'll see as the attachment point for the cruciate ligaments there. All right, so the medial condyle of the tibia is going to articulate with the medial condyle of the femur. And then on the front or anterior surface of the proximal portion of the tibia, we'll have this bump there, and that's called the tibial tuberosity, and that's where the patella ligament attaches onto. You can feel that bump right below your knee on the front of your shin there. Right? So for the tibia, the shin there, we call that the anterior border or margin. But when we get down to the distal portion of your tibia, you can feel it right now. If you feel around your ankle, you'll feel this little bump. I shouldn't say it little, it's pretty prominent, right? It's this rounded bump, right? That's a process there. We call that the medial malleolus, and you can feel that on the medial portion of your ankle there, right? So now the other bone, not a lot goes on with the tibia and the fibula. The other bone is the fibula. This is the non-weight bearing bone. This is the smaller, or I shouldn't say smaller, but thinner, more slender bone. It's the non-weight bearing lateral bone there. And so for the fibula, right, we have the proximal end is known as the head. And then it kind of, it gets a little bit skinny, and where it's kind of slims down, that's the neck. Now, it's important you should know this, and I don't have this in the notes, but you have a nerve that likes to come in close contact and wrap around the neck of the fibula. And that's called the common peroneal nerve. So if you were to injure that nerve, sever it for whatever reason, you break your fibula, all right, you fracture it at the neck of the fibula, and that can slice the nerve, you'll get paralysis of those muscles on the lateral portion of your leg. All right, those are called the Peronei muscles, and they help to evert, turn the sole of your foot outward or laterally. If you go down all the way down to your ankle and you feel this bump, right, on the lateral part of your ankle, that is the lateral malleolus. So you'll feel that on the lateral portion of your ankle. All right, getting down into the final portion of the lower extremity, that is going to be your foot. Let's talk about the tarsal bones. In the wrist, we had 8 carpal bones, and that allowed for the mobility of the movements there at the wrist. Well, in your foot, you have 7 tarsal bones. And so they're going to be similar to the carpal bones in that we have a proximal row and a distal row. All right, in the proximal row, you're only going to have 3 bones. The talus, okay, that's going to be the bone that helps to make up your talocrural joint, otherwise known as your ankle joint. Then you're going to have your calcaneus, that's your heel bone, and then the navicular bone, okay? So the talus is pretty much going to be the most superior bone on your foot, and that's going to articulate with the tibia and the fibula to make up your ankle joint. And then your heel bone is going to be the calcaneus, and that's where the calcaneal tendon or the Achilles tendon attaches onto, all right, the posterior end of your heel there, of the calcaneus. And then in front of the talus, right, you're going to have the navicular bone, but that'll be on the medial side there. I'll show you that in a second. Let's do the distal row. The distal row is made up of 4 bones. Okay, so 3 of those bones are called the cuneiforms, and then the 4th bone is called the cuboid bone. So the cuneiforms are going to articulate directly with a metatarsal bone. So you have a medial, intermediate, and lateral cuneiform bones. So we start with the big toe, right, and then we work our way lateral. So the medial, intermediate, and lateral cuneiform bones. So there's 3 of those. And then the most laterally placed bone is the cuboid bone, and that's going to articulate directly with the 4th and 5th metatarsal bone. And I'll show you. All right, so here's a nice view of the foot here, and what we call a dorsal view. We're looking down on top of the foot. All right, you can really see, all right, the metatarsals and the phalanges nicely in this view. So here are all the phalanges. Here are the metatarsal bones. Here are some of the tarsal bones. You can see 2 out of the 4 distal row bones pretty easily. All right, but then you can see some of the proximal bones. Okay, you can see the navicular bone, part of the talus. It's hard to see the calcaneus because all the other bones are stacked on top of it. And then the lateral cuneiform and the cuboid bone are kind of overlapping one another. So it's tough to get a really good view there. And here you can see the lateral view, nice picture here of the calcaneus. Then you can see the talus here, which makes up your ankle joint. Here's the navicular bone. And then you can see some of your cuneiforms and your cuboid bone over here. And again, you'll see some of the metatarsals and the phalanges. Okay, so here, let's go over some of the bones here of the proximal row. We'll start off here with the talus. That's the superior most bone. You can see it here articulating with the tibia and the fibula here for our ankle joint. And you can see this is a nice superior view of the talus. And then now this is an inferior view looking up through the bottom of your foot. All right, then we're looking at the calcaneus. Again, it's tough to see in the superior view here, but when you're looking at it from the inferior view, it's nice and easy to see. And then, of course, you have the navicular bone right here that sits just in front of the talus, and it's going to be placed medial. So here you can see it from the inferior view. So the talus, the calcaneus, and the navicular bone, that makes up your proximal row. And then our distal row is going to be made up of our cuneiforms and the cuboid bone. So you have your medial cuneiform, your intermediate cuneiform, and your lateral cuneiform. And then finally, you'll have your cuboid bone here and here. There's another way to label the cuneiforms. I'll show you that when we're labeling the bones here in a moment. All right, and then finally, our metatarsals. This makes the arch of your foot. Okay, we label metatarsals the same ways we labeled the metacarpals. We're going to use Roman numerals. And so we started with the thumb in your hand. So that was Roman numeral number 1. So here in the foot, we're going to start off with, all right, your big toe. And that will be Roman numeral number 1. We're going to go from the medial aspect to the lateral aspect. So the big toe is going to be number 1, and then the pinky toe will be number 5. Okay, so here we'll also see, and by the metatarsals, right, they articulate with the distal row of your tarsals, and then the heads of the metatarsals will directly articulate with the proximal phalange of all your digit toes. And we'll also see, which is kind of neat, 2 small, all right, bones, right, that are going to be found in the tendon here by your large toe. So we call those sesamoid bones. And there's 2 of them, and you'll see it right there by the head of the first metatarsal. All right, so here you can see your metatarsals. These will make up the arch of your foot here. And again, you can see how we label them. We start with the big toe, that is Roman numeral number 1, and then we go all the way across to the most lateral toe, and that is going to be your pinky, and that is Roman numeral number 5. Okay, it's pretty self-explanatory. Then finally, we have the phalanges. This is the bones that actually make up your toes. We have 14 of them. Similar scenario that we saw right in the phalanges of your hands. Okay, the thumb had 2. It had a proximal and a distal phalange, while your big toe, the hallux, has a proximal and a distal phalange. Meaning the other 4 toes will have 3 phalanges. Hard to imagine in the pinky toe because it's so small, but believe it or not, it does. Okay, if you don't believe me, let's look at the skeleton here. So our proximal phalanges, you have 5 of them right across. And the distal, same thing, you have 5 of them right across. But only in the middle phalanges, you will only find those present in digits 2, 3, 4, and 5. Okay, you will not have a middle phalange in your big toe. Okay, we ain't got time for that. We have a proximal and distal phalange in the big toe, and that's it. I'm not going to fit your middle phalange in there. You can't make us. All right, what are the 7 tarsal bones? Okay, we have 2 rows, proximal and distal row. The proximal row is made up of only 3 tarsal bones, the talus, calcaneus, and the navicular bones. Then our distal row is made up of the cuneiforms and the cuboid bone. There are 3 cuneiforms, medial, intermediate, and lateral. All right, see, we're flying through this stuff, but again, I don't think I'm giving you anything more than you can handle. Let's finish up tonight, okay, with our labeling for the lower extremity. So if you put them away, pull them back out, this is the last part. Oh, that's the wrong one. All right. I think I know what I'm doing. Yes, I say that. I ain't got time for that. You can quote me on that one, Rachel. All right. So let's jump back in. Let's finish up our labeling. And then we can all go back to celebrating whatever it was you were celebrating today. If you want, you can celebrate my birthday. All right. Let's finish this up here and talk about the tibia. Okay. So what we're looking at here, in case you're not sure, this is an anterior view of your tibia. The arrow is pointing to the proximal end, the proximal epiphysis, and so it's directly pointing to that flat surface on the top part of the tibia. That is the medial condyle. All right. Now, when you're looking at this bone, you might not have any single idea which is lateral and which is. Yes, David, you are good. You are good. Yes, it was a not so subtle hint. And I am not that type of person. I'm not that type of person to go out there and tell people, but I have a little fun with you guys. Yeah, see, on my birthday, I'm sitting here teaching you. Isn't that wonderful? No, Christina, that's my wife. She wants everybody to know that it's her birthday because then she wants to celebrate it all month long. I don't do that. Plus, when you get my age, there's really not much to celebrate as you get older. You want to get younger. Okay, so you can see that flat surface up there is the medial condyle, the 64th. Oh my gosh. Thank you. Thank you very much. Couldn't even give it, you couldn't even say 65 because then I would have been like, at least I'm going into Medicare. No, I'm not 64. Y'all are funny. So how do I know when I'm looking here at the tibia, how do I know which side, I know this is the anterior view, but how do I know which is the medial side of the tibia and which is the lateral side? Easy. When you're looking at the tibia, go to the distal end. That'll be this end. And for the most part, folks, we're not going to trick you and turn the bone upside down. Usually the bone, the top part of the bone is the proximal end and the bottom part is the distal end. Flattery will get you everywhere, Rachel. Okay, so how do I know which is the medial and lateral side? Look for the nubbin down here at the bottom. See that little guy? That process there? That's the medial malleolus. The medial malleolus is that bump that I told you about that you can feel on the inside of your ankle. Okay, that's that process there. So when you see the tibia, and again, if you're not learning these bones first and then learning the landmarks on them, I would make sure that if you were to see a picture of a bone, that you could, without a doubt, tell me what type of bone it is, that you wouldn't confuse it with another long bone. Okay, because some of these bones look familiar. People will confuse the tibia and the humerus all the time. They'll confuse the radius and or ulna with the fibula all the time. So you need to know these bones, exactly what they are. So when you're looking at the tibia, go down to the distal end. You see that nubbin? That is going to be the medial malleolus. That's your medial side. So they're both on the same side. That's the tibia. That right there is the medial condyle. So now what we've done is we've just turned the bone over. This is the this is the posterior view. All right, how do I know it's the posterior view? We go back, you'll see this structure. We're going to label this in a second. That's the tibial tuberosity. That's that bump just below your knee on your leg. Okay, that's where the patellar ligament attaches on. That's only on the front. See, when we flip the bone over, it disappears. Okay, it's no longer there. We don't see it. So this is the posterior view. But I still know it's the medial side because there's the medial malleolus. Okay, so there's the medial condyle on the posterior view. Here's the lateral condyle on the anterior view. Again, how do I know I'm on the anterior view? Look at that. That tibial tuberosity is just jumping out at me. And I know it's the lateral side because, look, the medial malleolus is on the opposite side. Flip over the bone. This is the posterior view. No tibial tuberosity, but there is a lateral condyle, all right, that is opposite the medial malleolus. That's how you know. Those are the little tricks. And so you'll see this little elevation in between those two condyles right here. That's the intercondylar eminence. That's where our cruciate ligaments attach onto. So it prevents your knee from sliding forward or backwards. All right, so on the front, here's the tibial tuberosity. That's where the patellar ligament attaches onto. There is a condition called Osgood Schlatters, right? And that's when that tibial tuberosity becomes grossly oversized because there's a lot of bone remodeling that occurs in that area there. Go down to the distal end of the tibia. There's the medial malleolus. That's that bump on the medial side of your ankle. Here you can see it on the posterior view. Same thing. All right, let's go on to the second bone in your leg, and that's the fibula. The head of the fibula is at the proximal end. It starts to narrow down. That's the neck of the fibula. That's where your common peroneal nerve, all right, is in close proximity of. And then at the distal far end, that is the lateral malleolus. That is the bump on the lateral side of your ankle. Don't confuse the bottom part of this page for the proximal part of the bone, meaning, okay, the head will be at the top of the page, the malleolus will be at the bottom of the page. You do not flip that around. Here you can see the lateral malleolus on our bone here. Here's the fibula. Okay, superimposed on top of the tibia. All right, there's the lateral malleolus. All right, let's talk about the tarsals. We have 7 tarsals. We'll start with the proximal row. Here's the calcaneus. That's your heel bone. Here it is on the medial view. Okay, this right here is that medial malleolus right there too. Okay, so there's the calcaneus on the medial view. All right, here's the talus. That is going to be the bone that is one of the bones that makes up the ankle joint. That actual specific part of the talus that the arrow is pointing to is called the dome of the talus. Here you can see the talus from the medial view. It's above the calcaneus there. And then just in front of the talus on the medial side is the navicular bone. Those 3 bones. So everything behind or below this red line that I drew in, that is going to be the proximal row. There's the navicular bone from the superior view. Here it is from the lateral view. There you go. To the right of that red line, that's all the proximal row. Now we're going to talk about the distal row. So you have 3 cuneiforms. The medial cuneiform articulates with the first metatarsal. You can also call that cuneiform Roman numeral 1. That's the other way that you can label these. Medial cuneiform or cuneiform Roman numeral 1 articulates with your first metatarsal. Okay, here you can see it on the medial view. There it is, medial cuneiform. Then our second cuneiform is the intermediate cuneiform or cuneiform 2 that articulates with the second metatarsal. Then our third cuneiform is the lateral cuneiform or cuneiform 3. And so that articulates with the third metatarsal. And then our last tarsal bone in the distal row is the cuboid. And that articulates with metatarsals 4 and 5. So here you can see the cuboid on the superior view, and here it is on the lateral view. And the rest of this stuff is so easy for you. I'm still going to go through it, okay? But I know you're going to be like, this is the easy part, Dr. Kaz. Metatarsal, Roman numeral number 1 starts medial. The biggest digit, the big toe, the hallux, is metatarsal 1. There's metatarsal 2, second digit. Metatarsal number 3, third digit. Metatarsal number 4, fourth digit. And then metatarsal number 5, fifth digit. Easy, right? Medial lateral, 1 to 5. And then we have 14 phalanges. Okay, here's the lateral view of metatarsal number 5. The last one in, Rachel, is this is the last one in the distal row, and that's the cuboid. This is the last cuneiform, and that's called the lateral cuneiform or cuneiform number 3. So you have 3 cuneiforms: medial, intermediate, and lateral. And then you have the cuboid, which is the last tarsal in the distal row. And then we have our phalanges, or individually, all right, the phalanx. So you have 5 proximal phalanges, 5 distal phalanges, 4 middle phalanges. So the first proximal phalanx is going to be proximal phalanx number 1. That'll be in the big toe. Then you have your proximal phalanx 2. That'll be in the second digit. And that goes all the way across. Okay, so this will be 3. All right, then this would be proximal phalanx 4. And then proximal phalanx 5. So here you can see proximal phalanx 5 in the lateral view. All right, then we have our middle phalanges, okay, middle phalanx 2. Right there, you can see it in this view. And then you'll have the middle phalanx 5. Let me go back here. All right, so this is going to be middle phalanx 3. All right, I think you guys got the point. Middle phalanx 4. And then middle phalanx 5, right there, that little thing. Okay. Then you can see it here in the lateral view. Middle phalanx 5. And then finally, distal phalanx 1, 2, 3, 4, and 5. Okay, so that's the distal phalanx 1. Then the distal phalanx 5 will be over here. And then we'll see it on the lateral view. So there's distal phalanx 2. And then there's distal phalanx 5. Woo! Folks, we did it. And we did it together.